Good afternoon, everybody. I'm still not selling anything, so hang out for a few minutes. Today is a little serious for me. You can officially say that you know or you have seen someone who no longer has health insurance. My Medicaid was cut off after 15 years of being on Medicaid. I no longer qualify, according to the administration. I require for my life medications. I take 23 pills a day. From about a dozen medications. My total bill, if I were to buy them myself, which I can't afford to do, but it's $1,168 a month for my medications. I am not going to be able to afford that. I just afforded what I could. I got 7 medications out of 12. I can't buy the other ones. Some of them are just way out of touch.
Good morning, y'all. So here where I live in North Carolina, the main headlines is talking about how the Medicaid cuts are starting to take effect. They are starting to take effect. And I guess Cheeto just left it up to the individual states, and our governor, Josh Stein, he is great. So he mainly didn't mess with the children's programs for the government funding, but he mostly cut the adult programs, which is still bad, but he looked out for the kids. And so these Medicaid cuts, Medicaid funds people that don't have the income to pay for health insurance, so therefore they fund a lot of these clinics in the rural communities, out in the middle of God knows where. Yeah, a lot of those are funded, and the state hospitals, but it's a lot in the rural areas.
The Department of Health and Human Services today reached out to all Medicaid providers and gave us an update on Medicaid funding and where things are going for the next fiscal year. It's not good. They have cut 3% of all reimbursement rates for all services. That's healthcare, behavioral health, long-term care, nursing home care, child care, all of it. Everything got cut by 3%. But that wasn't enough to work with the budget that was given to them by the General Assembly. So they have a $319 million budget shortfall. So many programs also had an 8% cut instead of 3%, and some programs had a 10% cut. Here are some examples of the programs that had 10% cut. Inpatient healthcare stays, outpatient hospital stays, nursing home care took a 10% cut. PRTFs, psychiatric rehabilitation treatment facilities.
I'm going to go to work with a pretty heavy heart today because 52% of my Foundation U2 doctors who have finished Foundation 2 yesterday, I know that they're just unemployed. They're going to be driving taxis, Uber Eats, working in audio, whatever. And the other 48% that are going to be joining me, I know that a lot of them have finished work yesterday at 12 o'clock.
So since my last post about being let go as a doctor, I've been getting a lot of DMs, phone calls about how other doctors or people they know have been let go. A doctor at UCSF and their department having a 3-month wait, they were let go, along with